Did you know that cervical cancer is one of the most preventable cancers? Welcome to the Inspired Vitality Show. I'm Catherine, and in this video, I'm going to provide an overview of cervical cancer, the risk factors, symptoms, and treatments for this disease. January is Cervical Cancer Awareness Month, and it was established to help raise awareness about the importance of HPV vaccination, prevention, screening, and early detection. Cervical cancer begins in the cervix, the narrow opening into the uterus from the vagina. It occurs most often in women over age 30. According to the National Cervical Cancer Coalition, cervical cancer is the fourth most common type of cancer for women worldwide. But because it develops over time, it is also one of the most preventable types of cancer. Let's go over the risk factors. All women are at risk for cervical cancer. Nearly all cervical cancers are caused by human papillomavirus. Papilloma, or HPV, is a common virus that can be passed from one person to another during sex. There are over 100 types of HPV, and while most women have HPV at some point in their lives, the majority of women infected with the HPV do not develop cervical cancer. Other risk factors can include smoking, a compromised immune system, having given birth to 3 or more children, and having several sexual partners. Generally, early stages of cervical cancer do not show symptoms. For this reason, regular screenings through Pap and HPV tests can help catch precancerous cell changes early and prevent the development of cervical cancer. So let's take a closer look at the screening tests. A Pap test, or Pap smear, looks for precancers or cell changes on the cervix that might become cervical cancer if they are not treated appropriately. The HPV test looks for the virus that can cause these cell changes. Possible symptoms of more advanced disease may include abnormal or irregular vaginal bleeding, pain during sex, or vaginal discharge. If you're experiencing any of these symptoms, there could be a variety of causes, and you should see your healthcare provider. I want you to have a clear understanding of the potential results from the screenings. A Pap test result can be normal, unclear, or abnormal. A normal or negative result means that no cell changes were found on your cervix. It is common for test results to come back unclear or inconclusive, meaning that your cervical cells look like they could be abnormal. At this point, it's not clear if it's related to HPV. It can be related to life changes like pregnancy, menopause, or infection. If your results are unclear, ask your doctor what to do next. An abnormal result means that cell changes were found on your cervix. This usually does not mean that you have cervical cancer. Abnormal changes on your cervix are likely caused by HPV. The changes can range from minor to serious, and you may need additional testing. An HPV test result can be positive or negative. A negative HPV test means that you do not have an HPV type that is linked to cervical cancer. A positive HPV test means that you do have an HPV type that may be linked to cervical cancer. This does not mean that you have cervical cancer now, but it could be a warning sign. The specific HPV type may be identified to determine the next step. Cervical cancer is treated in several ways. It could depend on the type of cervical cancer and how far it has spread. Treatments may include surgery, chemotherapy, and radiation. If you have cervical cancer risk factors or symptoms, be sure to discuss screening options with your healthcare provider. As with all cancers, early detection is important for the best treatment options, and being diligent with your screenings is the path to early detection. I hope this video has given you a better understanding of HPV and cervical cancer. Please share this video with the women in your life so that together we become empowered with our health. See you in the next video.